So the first thing I want to talk about is how you as PTAs can really help advocate and make sure that you've got appropriate staffing of school and community mental health professionals. You guys are critical data collectors. I would strongly encourage you, if you're not already, to take a look at the data in your school and your district. And do you have adequate ratios of school psychologists, counselors, and social workers? The National Association of School Psychologists, we recommend one school psychologist for every 500 students in order to make sure that comprehensive school psychological services are available to every student and every family that needs that. Unfortunately, that is not the case in the vast majority of schools across the country, and we need to continue to put pressure on building principals, school board members, state and federal leadership to make sure that we are prioritizing efforts that recruit and retain these critical professionals. And PTAs are an absolutely vital voice in this process. If you're not doing this work already, I strongly encourage you to start to build coalitions, build local coalitions, partner with your teachers, with your school psychologists, social workers, find those professionals in your school and those other advocates in your community who are fighting for increased access to mental health services. Start a coalition, start to, bring this to the attention and make sure that it is on the radar of your principal and your school board, and hold them accountable for taking some action to address the ratios. This goes for community mental health providers as well. If your school doesn't have a community mental health partnership, why not? Start those conversations with your principals, start those with your school boards. Don't wait for them to come to you to ask what you think that we should do about this issue. Go to them. Tell them that we need to make sure that we're increasing access to these right professionals. And then certainly it's critical. We all like data. We all want to make sure that any initiative that we are engaging in is meeting the needs of our individual school communities. And PTAs absolutely should be a part of that school and district level leadership team who might be conducting a needs assessment to say, let's look across our school and across our district at what the needs of our students are, what the needs of our community are, what resources we already have in place, and what resource gaps exist, so that you can be a part of that problem-solving team to identify partnerships and identify resources in the community that can be brought into the school to help supplement services that the school may already be providing. Second, it's really important, again, with anything that we do in education, that we've got clearly defined roles and responsibilities. So what is the school committing to do? And what is the community committing to do? And parent voice on these leadership teams is absolutely critical. It is imperative that in any kind of community partnership that we have, not just to address mental and behavioral health, but any other issue that the school is trying to tackle, that parent voice be included. You absolutely need to be on those leadership teams. If there's a leadership team that exists right now in your school community and parents are not a part of it, walk in and demand that you become a part of that partnership, because part of an effective partnership in anything is making sure that there is clear communication and family engagement. And unfortunately, I wish that this were not the case, but oftentimes that is not something that is thought of as much without parents on that team. And so I think it is imperative that you make sure that parents are part of that leadership team, so that you and other families have complete understanding of what this partnership is going to do, who it's intended to serve, how they intend to serve students, and to make sure that that communication is provided to families in multiple ways. That goes beyond just an email or an in-person meeting. You know the needs of your families, you know the needs of your parents, and you need to be part of those conversations. And again, I think it's also important, and this is where PTAs can certainly play a critical role, is that we need to make sure we're continually examining the role that a partnership is playing in our school community. Did they deliver what they said they were going to deliver? Are they continuing to meet the needs of our schools? I think we could all probably think of examples in our own life where perhaps we were working with a childcare provider, or you needed someone to help you do something at work, or help you do something in your home. And after a while, Perhaps it wasn't just the best fit for you. Maybe the needs of your family's changed, and so you needed to find a different provider. This needs to happen with our school and community partnerships. There's absolutely nothing wrong with saying, you know what, you were a great partner for a couple of years, but now the needs of our school community has changed, and we just don't think that you're a good fit anymore. And it's important for parents to be part of that decision-making process. You can be part of the team and the problem-solving group who is looking at the ever-revolving needs of the school community and the ever-changing role of the community landscape. Perhaps there is a new organization that has recently, set up roots in your community that you think would be a great fit for your school. Parents can absolutely continue to be that conduit of information and conduit of partnerships between the school and other community organizations that perhaps the principal or district leadership just isn't aware of, but you are, because of your activity and your involvement and just your deep connections within your community. So again, if you're not part of these teams already, if these teams don't exist, pick up the phone tomorrow, call your principal, call your district leadership and say, this is what I want to do. I want to make sure parents are a part of this, and here's why I think it is important. And then lastly, and this is where I think you guys are such strong advocates, and you may not realize how influential and powerful you are, but I have to say that anytime I am talking to anyone about ways to really push forward any type of policy, but especially policy and practice related to mental and behavioral health, my first question is always, are you in contact with your local PTA? Are you connected with your state PTA? Are the parents involved? Because the system is serving you. It is serving your families. You are an incredibly powerful and influential advocate. And unfortunately, money doesn't grow on trees. I wish I had a money tree. I'm sure we all wish we had money trees. Unfortunately, we still have to continue to fight for money for things related to student and staff wellness. And so I would strongly encourage you. You can play an absolutely critical role in pressuring your local school board. Are they prioritizing money for staff? Are we adequately compensating staff to make sure that you're able to attract and recruit and retain adequate numbers of staffing in your local school district? What state funding streams are out there? What federal funding streams are out there? You can use your voice at all of those levels to really make sure that local, state, and federal budgets are prioritizing comprehensive systems of school and mental and behavioral health so that you don't continue to have to fight for these in your local communities. It's also really important to understand that we need to make sure that our funding sources are braided and diverse. Grants, short-term grants are incredibly important, and they certainly serve a role, particularly in helping schools start, and initiate the development of a comprehensive system. But in order for it to be sustainable, we have to have diverse funding streams. We can't just rely on single grants, because oftentimes when those grants run out, if local school boards haven't done that long-term planning, those services tend to go away. So PTAs can absolutely be critical in helping to identify potential sources of community funding. You can certainly be a strong advocate at the state level to make sure that states are offering long-term sustainable funding streams that districts can easily access. And then I think, the linchpin in all of this is holding school boards and decision makers accountable for how that money is used. At the end of the year, let's look at, the school board said they promised they were going to spend $10 million on bringing in school psychologists, counselors, and social workers. Did they do that? I think it's imperative in any work that we do in education that we need to make sure we're not only holding our school board members accountable for what they said they would do in the best interest of students, but did their efforts deliver the results that they promised? And if they didn't, you guys as PTAs in collaboration with other advocates and other educators need to hold them accountable and need to be part of that solution and problem solving team to make great change.
4 years ago, when I attended a PTA meeting for the first time, I was struck to learn that our PTA was funding contracts for critical positions in child health. A significant majority of our PTA's budget was invested in paying for a half-time school counselor, which meant that fundraising was an absolutely critical part of our community. That is, our school community wasn't raising money for optional enrichments. We were raising it to spend on an essential support, a school counselor. Also, our school only had a school nurse for 12 hours per week. And at one point, our PTA managed to double those hours with some additional funds raised in an auction. By then, I had learned a lot more about how all this works, and it was quite clear to most of our active PTA volunteers that these contracts were volatile. From year to year, certain fundraising goals would have to be met, or else these essential health professionals would not be afforded to our school community. Now, you might be thinking, how did we get into this situation? Why would a local PTA have to raise money for basic health services like a school nurse or a school counselor? Why would those essential supports depend on such a volatile source of funding? The simple answer is that the Washington state funding for these positions is extremely low. More on that in a moment. This has been heavy on my mind for years, but even heavier on my mind was what I was imagining in other school communities throughout Washington state, where fundraising to supplement staff salaries would simply not be possible. That our school community could hold together these volatile contracts has taken a lot of work, money, and complex coordinated efforts. It breaks my heart whenever I consider the deep inequity of school nurses, counselors, social workers, and psychologists being available only to those children in Washington state who happen to live in communities who can afford it. Now, enter 2020, enter COVID. Schools shut down, and immediately we all had to imagine what it would be like to reopen them. My mind went straight to the sobering fact that schools all across Washington state might have to reopen in a pandemic without a school nurse. It was also terrifying to consider the mental health impact of the quarantine and that children would at some point return to school without a mental health expert to help them get through it. I became very concerned, and I started to realize that I was not alone. At the same time as the pandemic was just beginning to unfold, we were deep in the nominating committee process, and just about every potential volunteer that we spoke to wanted to know how they could help those who needed it the most. So we started having advocacy committee meetings, something that our PTA had not done in recent years. We invited child health advocates from a number of nonprofits throughout Seattle who could educate us on their own efforts to get state funding for school health professionals. It didn't take long to realize that this would require legislation. And so we scheduled a town hall with our local district's legislators. We took every opportunity that came along, and eventually this was noticed by the Washington State PTA Advocacy Committee. We learned about the WSPTA's process for establishing legislative priorities, and we fully engaged. We submitted a proposal to increase access to nursing, mental health, and social emotional learning staff. We went through the whole process, and at the WSPTA Legislative Assembly, hundreds of voting delegates from all over Washington state came together and voted our issue as the #1 priority for the next 2-year legislative cycle. Since then, we have been working with the WSPTA advocacy team on the issue, meeting with legislators, deciding together for which bills we should express the support of the WSPTA, and providing public testimony in legislative committee hearings almost weekly. Every chance we have had to show our legislators how urgent is this need for all children, we have taken. As an example, I'd like to show you a video that we put together to educate our state legislators on the issue. Washington State PTA stands united in support for the medical and mental health of all students P through 12 with innovative funding solutions for increased non-teaching staff, including, but not limited to, nurses, counselors, social workers, and psychologists in schools, provided by both in-person and telehealth access. To provide proper daily medical management and harm prevention, the National Association of School Nurses recommends the school nurse to student ratios you see here. But let's take a look at the ratios that are funded by the Washington State Prototypical School Funding Model. It funds 1 school nurse for every 6,250 high school students, 1 school nurse for every 7,200 middle school students, and 1 school nurse for every 5,263 elementary school students. Clearly, the medical needs of students are not being prioritized. So how about the mental health needs of our students? The American School Counselor Association recommends one school counselor for every 250 students. But take a look at the prototypical school funding model. Why would sufficient funding for school counselors at the middle and elementary school levels not be a state priority? Every stage of student development presents unique mental health challenges, from the initial development of social skills in preschool to important decisions about risk and opportunity in high school. Every child deserves equitable access to the guidance necessary for their individual success, which mental health professionals are uniquely trained to provide. So why so few school counselors relative to expert recommendations? Could other mental health professionals be making up for the lack of school counselors? How about school social workers? The National Association of Social Workers recommends one school social worker for every 250 students. At that ratio, the number of school social workers would help quite a bit. But unfortunately, the prototypical school funding model supports ratios which are dramatically insufficient. In fact, in this chart, you have to use a magnifying glass to see the students. The school psychologist story is even worse, where once again Washington State does not adhere to the national recommendation, with negligible funding for school psychologists. With these ratios, how exactly are schools managing student health? When a school is without a nurse, counselor, social worker, or psychologist, the need for health services does not go away. School districts and local school communities overwhelmingly agree that this is unacceptable. And so other sources of funding are used, which creates a severe equity issue, affording basic health needs disproportionately to those communities that are able to generate additional revenue. Without additional funding, school communities are forced to use staff who are not adequately trained to deliver health services. But this is not just an equity issue. Depriving children of basic health services is a severe public health issue, and the COVID-19 pandemic has made that even more clear. How can we consider in-person school without sufficient school nurses? How can we consider skimping on mental health professionals while our children endure the emotional difficulties of the pandemic? Back in 2011, Washington voters approved Initiative 1351, which requires increased funding to support stipulated staff-to-student target ratios. As an example, let's visit our school nurse ratios. You can see how the ratios would improve as required under Initiative 1351. There are similar improvements for mental health professionals, and voters expected this funding to be completed by the end of 2019. But in 2015, the legislature voted to delay it. In 2018, the legislature directed OSPI to convene a technical work group to review the stipulated ratios. The work group's recommendations reaffirmed what Washington voters said nearly 10 years ago: staffing levels must be raised to meet student needs. In the 2020 supplemental budget, lawmakers added funding for additional counselors in high-poverty schools. But, out of fiscal prudence, the new investment was vetoed. School communities should not be forced to imagine how to keep children safe and healthy without adequate support from health professionals, and so state leaders need to think outside the box to carve out the solutions and the funds, because the need is increasing faster than ever. Please make additional investments to address our students' medical and mental health needs this budget cycle. Our students are counting on you. We are not done yet. There is so much work to be done to get basic health services into schools across Washington state, and we will get this work done. We have to. I am extremely proud of our school community. When I look at the list of initiatives that Mel presented earlier, I have to just say that it is humbling, to say the very least, to witness people putting all of that together. And even more so, to know that in local school communities around the world, people have found ways to adapt family and community engagement to the constraints of the quarantine. That took a lot of creativity, a willingness to reinvent the playbook, and a commitment to family and community engagement as a pillar of a student's education. In a world apart from each other, with previously unimagined barriers to engagement, we connected families in every way that we could think of. The depth of the love and support embedded in the phrase, "it takes a village," has never been more apparent. Pandemic or not, we will never stop collaborating. We will never stop engaging. We will never stop representing the underrepresented, and we will never stop advocating for the well-being and success of all children.
I want to advocate, for all students, legislate and advocate for personnel and funding for mental health supports. You as PTA members can get to school board meetings. You can legislate for proper ratios for mental health support in the schools so that we can really do what our jobs are. And that is making sure that there's school counselors and social workers and school psychologists in every school, and that we can support every student, not just a few. So yeah, you get out there and spread the word and have these conversations.